Perspectives, a monthly podcast by Street Medicine Detroit. I'm Dee, I'm a medical student.
And I'm Austin. And today we have our very special guest. He is a third-year medical student here at Wayne State. He is the Vice President of Patient Consults for Street Medicine Detroit. Welcome to the show, Jed Bell.
Thanks, guys. Thanks for having me here.
Yeah, so excited to have you here. So you're a third-year medical student right now.
I am.
What's that like? How is that different?
So much better than first and second year. I think first and second year is exciting because, well, maybe the first part is exciting because like medical school, this is what I've been trying to get into for years and years. You're finally there. You start learning about the human body and clinical situations and scenarios. But then it becomes very much book learning, and even though you have a little bit of patient contact. It's only really, I think, third year when you begin to see sort of the intricacies of what you're actually studying, and it comes to life. And you know, I like medicine, but I also like patient stories. And so when you're in the hospital, you actually get to interact with those stories.
That's awesome.
Yeah, that's incredible. What kind of things do you like about that situation? Like, how were you drawn to medicine? So you talk about these stories, and what kind of, sparked that fuel in the first place to want to learn about people that may be sick?
Yeah. So to be honest, I think I struggled initially to get to medicine because there were so many things that I was drawn to. And part of it is, just like I said, I love talking to people just in general, discovering their stories and figuring out, okay, how can we take you from here and move you forward? And I think medicine offers a very unique role for doctors to be able to walk with patients through rough times and bring them through, or rough times which last their entire life and continue to walk through that time with them. So
Yeah, absolutely.
that was I think one of the initial draws to medicine for me.
Mm-hmm. At what point did you know that you wanted to do medicine? Because you said you were interested in a lot of different things.
Yeah, so I think when I first told this to Amanda, who is the other vice president of Street Medicine Detroit, I think she laughed at me, but I said I only really knew that I wanted to do medicine when I walked in the first day at Wayne State for medical school. So I got accepted. I was like, oh, is this the right thing to do? And then I walked into class and I sat down. I was like, yeah, this is what's supposed to be.
Mm-hmm.
Awesome.
So you mentioned you're the vice president of Patient Consults.
Yeah.
The way that street medicine is structured, for people who don't know, is that we have a president, two vice presidents for different reasons. But do you want to talk about kind of the structure of that and what exactly it is that you're in charge of?
Right. So Patient Consults is dealing with everything which happens in the hospital, pretty much. So most of street medicine, most what people think about street medicine, whether they're students or other doctors or health practitioners around Detroit, they think about the outreach which we do, which is the main component of what we do. And then the inpatient consult is, at the moment, we're only doing one hospital in Detroit. We're hoping to expand it to some more. But homeless folk will often show up at hospitals around the country. And unfortunately, they have very high rates of readmission. So they might get discharged, but the numbers are about 2 to 4 times the rates of 30-day readmission than the normal population. So it's decently high. Right, so it's decently high. And so what we like to do is we think that it's a prime time to sort of intervene with homeless patients when they're in the hospital. So we'll get called for a consult by a case manager, by a doctor, by a resident, by a social worker, by another medical student. And we'll go see a patient, we'll find out their story, we'll find out, do we have any history with them on the streets? And then we'll try to connect them, see what their situation is, try to connect them with resources outside of the hospital whilst they're still inside the hospital.
Mm-hmm.
Then as they get discharged, we don't just say, here are your meds, here are prescriptions, come back in a month. We will actively try follow up with them. So we have some partners which in the areas at Covenant Care who do a lot of great outreach. We'll connect them with them, we'll see them with them inside the hospital, and then when they're outside, Covenant Care will follow up with them. When we go on street runs,
Right.
we'll go follow up with them. think this is a really key. I think it's a really important intervention, which is why I'm speaking so long about it. But I think it's a very key intervention because these patients are often lost to follow-up, and through no fault of their own, I think they find it hard to get medications, to come back for follow-up appointments, and so instead of catching something early on, we're going to wait until they have this terrible exacerbation of their illness, and then they come in, and then they have worse outcome, and then the hospital has higher rates. So this is also a financially viable option for hospitals to support street medicine outreach programs like this. And one of the main things we focus on as well with the inpatient services, we're pretty strong in trying to get them into housing. And that's not easy. We strongly encourage patients, we strongly try to walk through them, because getting people off the streets is the best thing we can do for people's health. If you're unsheltered on the streets, you have a 10 times mortality rate than someone who is at the same poverty level as you, which is crazy. So you have a 10 times increased risk of dying. If we get them into a shelter, that becomes only 4 times, right? And if we get them out of a shelter and into their own housing, then it's back to the same mortality risk as the general population. Even if this is not taken into consideration, even if they have substance abuse, it doesn't really change those numbers. So that's why I think the consult service is a pretty important thing that we do. Yeah.
Yeah, I think that's really important. I feel like when people think about healthcare, they really just think about after the fact. I feel like a lot of preemptive measures in terms of getting people into housing and all the social determinants of health are so important. Right. And I feel like getting street med involved in the hospital is a good way to kind of bridge that gap.
Yeah. And I think there's there's disconnect between the homeless population and the medical community, and through valid reasons, I think on both sides. And we can argue about why, and we can argue and say this is why, this is it's justified. But the reality is it's there, and I think this is something we can do to start to bridge that gap. I think a lot of what street medicine does bridges that gap. And I think this is one of those key.
And you talk about Covenant Care. Can you talk a little bit more about what they do and how they're involved?
So Covenant Care, so they're a FQHC, so a federally qualified health clinic that's in Detroit. And they have a great grant at the moment, which they're working off of, to do homeless outreach. And so they'll go out, they'll take patients to appointments, so they'll go look out for patients, pretty much help them with anything that they need. If the patient has an appointment, they'll go find them on the street and take them to that appointment, wait outside the appointment with them, take them back to where they are. If they're struggling to get housing, they'll go with them to get their ID and help with cost of ID. So they do a very comprehensive, but very sort of on the fly, what best can we help you? And I think we work with a lot of great partners, and they're very committed, I think, and very available for patients. So,
yeah, these are some of the most important things, because this population, I think, they just have all of these barriers, and if we can catch them when you have them in front of you with the consult service, I think that's going to make a huge difference if we can really scale this up and see a really big impact through it. So it's really exciting. Exciting role to be a part of as this goes.
I'm excited with it. Yeah.
So I don't know if you're good. I don't know if people have realized that you have an accent yet.
Yeah.
But
a few times.
No,
sometimes people will talk about my accent. I'm from the UP. It doesn't get as much excitement as when you talk. So you are from where exactly?
So I'm from Zimbabwe, which is a small country in southern Africa.
Okay, incredible. So how did you end up in Detroit?
So I initially went to undergrad and got my bachelor's in Grand Rapids, Michigan.
Okay.
Went back to Zimbabwe for a bit. In the meantime, applied to medical schools around the States, and then got into Wayne, and Wayne accepted me.
Yeah.
So now I'm back.
Yeah. Was it something about Detroit that attracted you to Wayne?
Yeah. So I think Detroit and Wayne specifically, I think has a very strong focus on
community engagement and serving the community. And I think that's something which is in the mission statement, but I think there's some things which are often in mission statements which never get translated. I think this is one thing which really filters down to the doctors, to lecturers, and then to students. And I think that's with organizations like Street Medicine Detroit. And there's a number of student organizations, but there's also, I think, a number of doctors who I'm very inspired by the way that they are committed to the care of the patients around them. And I think there is a lot of need in Detroit. And yeah, I was impressed when I heard of that and sort of saw that for myself when I visited.
Did you hear about street medicine before you applied to Wayne, before you came here?
I didn't actually.
Oh, you didn't? Okay.
No. I think a lot of students now have heard of street medicine before they came to Wayne. I was not one of them. But when I did hear about it, I think it was probably in my first month that I heard about it. I was like, man, this is pretty cool.
Yeah.
When did you go on your first street run with us, or what was that experience like?
So that was I actually remember pretty well. It was the start of winter. It's a couple of months into my medical school sort of career, and we were on it. It was a street-based run. So we were on the street, and I remember we were in Dean Carpenter, who's our nurse practitioner, our preceptor. We were in his little car, and he was blasting some music from the 80s, and then you turn it down, and we just drive through the city. And I was very curious to how we do this, this street-based run, and you just back and forth, swiveling your head back and forth, looking around and looking for people. And at first I felt a little bit weird doing it, and we saw one patient, and it's just it was a patient that Dean knew before. I forget exactly what medical problems he had, but it was a fairly simple checkup and medication checkup. Checked his blood pressure, saw how he was doing. We gave him some gloves, and then as we left, and now I actually began to look in earnest for these people, and I started to think, okay, if I was homeless, where would I be? It's really cold outside. Where would I be? And I started looking for them. And I think I mentioned that to Dean, and he said, yeah, there's a problem now, because once you start looking, you won't be able to stop. And I think that's something which I think is powerful, and I think it's something which happens on street runs is once you start looking for homeless folk, you can be going downtown just to have fun, and you can go into Greektown, or you can go to the river, but you'll always be looking, and you won't be able to close your eyes, I think, to homeless folk anymore.
That's really powerful. I really relate to that, and that's really incredible change. Not that you don't even notice them before, but you to see it in an entirely different way.
100%.
When you go on runs through Street Med, or just get involved more, and make a conscious effort to just acknowledge these people.
Right.
Yeah, I can totally relate. I feel like there's a lot of stigma, and people are very hesitant to approach homeless people when they see them on the streets and things. But once you've done a couple street runs, you've interacted with so many, and you find that they're just as relatable as anyone else, and it makes it so much easier, and feels so natural to be able to interact with them just in your day-to-day life.
Yeah, and I think they move from being that person that's that homeless person that's on the side of the street to, oh yeah, that's Fred, who I know has this background and this story, and it just fleshes them out so much more.
For sure.
Yeah.
So you talked about your first experience on a run, but do you have a most memorable street run that sticks out in your head that just has been the most impactful throughout your time volunteering with the organization?
I think it's a hard question to answer, just because there have been a lot of patients, and when you say that, the first one which comes to mind might not be the most impactful, but it's the one which I think is in my mind the most memorable. And it was a patient who we had just left the Tumani Center. Tumani Center is where our base camp is, I guess. We're going on a street run, and it was sort of providential because we had forgotten the keys, so we had to go. We had to go back, and we turned around and went back into the parking lot, and there was a small crowd of people, and they like called us over and they said, "Oh, Nurse Dean, Nurse Dean." So Dean went running over, and there was a patient that was collapsed on the side of the building. And long story short, she had overdosed. We started breathing for her. We gave her some Narcan, and called EMS. Had to give her another thing of Narcan. She wasn't breathing on her own by the time that we found her. Very low. I think pulse ox was at 62% before we started breathing for her.
Right.
And as she was getting into the ambulance, she snapped out of it, and the Narcan finally kicked in. She was very agitated, very disoriented, very concerned that we were like, why was everyone standing around her, and why were we, someone had stolen something from my handbag, and she didn't realize the impact of what had just happened. And a friend was trying to say, look, I have this on camera. You had OD'd, you'd really need to go to the hospital to get checked out. But I think what was impactful for me for that was, this was just a very real issue for our patients. And this wasn't, far down the road under a bridge. It wasn't in some abandoned building. It was against the wall of the building, which we often go into and we often help our patients with. And I think that just drove home to me the necessity of what we do in continually reaching out to these patients. And I think substance use disorder and homelessness sometimes go hand in hand. And I think it's important, substance use disorder, even without homelessness, already has its own stigma.
Right.
And you really need to walk people through that. And I think when you add on homelessness to that, I think it's such a complex issue that needs to be addressed. So I think that's one of the first things which comes into my mind.
Yeah, absolutely.
That would be really memorable. You said you grew up in Zimbabwe before you came to undergrad. What was your childhood like? Were you always kind of interested in like service and like community service and that kind of thing as like family, or?
Yeah, so I come from a big family. There's 6 kids in my family, and I think I have really always enjoyed like service type things, and I think that's pretty much because it was modeled by my parents. So both my mom and dad have a ton of respect for the way that they just very selflessly commit themselves to meeting the needs of just others around them. And so I think I saw that growing up. I started to have opportunities to do that. I started some things and started helping out with some this outreach program to low income folk in my church, and doing sort of outreach with them. So I think that's where it started. Just watching pretty cool people and modeling myself after them.
Awesome. Are you one of the younger siblings, or?
I'm number 4. Yeah.
Okay.
So
Middle child.
yeah, exactly. Middle-ish child.
What were you like as a kid growing up?
What was I like as a kid? Man. Not a question I expected on a streaming podcast. I
keep you guessing.
I think how was I as a kid? When I was really young, I think, I don't know, what was I like as a kid?
Pretty quiet.
I was not quiet.
Yeah.
I think I had a lot of energy. I liked, doing things outside. So I spent a ton of time outside, and we had to do sport, but I loved doing sport. So, playing field hockey and cricket and squash. So I got pretty involved in that. I enjoy sort of taking leadership roles. So I would do leadership things at school. I loved debating. Yeah. So.
And do you see yourself going back to Zimbabwe? After
That's the
graduate
eventual
school?
plan.
Okay.
It'll take a little bit.
Mm-hmm.
But the eventual plan is to go back to Zimbabwe. And you know, as I was growing up, I sort of watched the effects of Zimbabwe go from a pretty good health system
Oh,
to a
wow.
health system which collapsed.
Wow.
And sort of seeing the effects of that, you know, that's one of the things I think which made me really think about medicine and its
Absolutely.
how it's necessity. And I'm into education
Mm-hmm.
and educating doctors and people. So I'd love to go back to Zimbabwe and be part of medical education there.
Awesome. So medical education over there, and you want to be a part of like the reshaping, and you want to like help bring this, you know, once thriving health system, and now not so much back to where it was, or just even surpass that. And that's kind of interesting too, because when you first joined Street Medicine, you were a part of the education and training department.
Yep.
So can you, I guess, explain a little bit of what that department does, and then kind of where would you like to see that department go in the future? Like if they had unlimited resources, what kinds of things do you think that they could really make an impact through what their role
Right.
is?
So education and training and Street Medicine Detroit focuses on training volunteers. First of all, it's sort of, I think there's a few aspects of it. First of all, is making sure volunteers are trained on what street medicine is, why we do what we do, and preparing them to interact with and serve homeless folk on the street.
Mm-hmm.
So I think that's the main goal. That's one of the main goals. And the way that they do that is not just this once-off orientation event, which is there, but just repeated seminars, repeated exercises throughout the year, where they will learn about, you know, motivational interviewing of homeless folk, or they'll have homeless folk that'll come in and they'll be part of a panel, which I think actually happened at the school.
Yeah.
Mm-hmm.
Just the other day they had one.
2 days ago.
Mm-hmm. Lydia spoke at the
Yeah, so Lydia Atkins, who is a lady that we work with, herself previously homeless, and and now such an advocate for other homeless folk, and
Yeah.
she works with the Road Home. And so hearing her story, and year after year, her story, students always come back and say, man, what a powerful story.
Mm-hmm.
So education and training makes sure that the students hear those stories and make sure that they're thinking about homelessness. And then it's also sort of the last facet of what education and training does, is making sure that street leaders, so more of the leadership of Street Medicine Detroit, is really well trained in what they do to make sure that they can help volunteers provide sort of the best care for patients, and make sure volunteers are thinking and reflecting on their experiences on the street. So what would you like?
Yes.
Yeah.
Third part of your question. So unlimited resources. I think that's a great question. I think it's something that we always have limited resources in
Right.
street medicine, so it's something that we need to get more in the practice of. Is having this thought experiment. So I think making the street medicine and the lessons that we learn and the things that we teach more integrated into the curriculum.
Yeah.
And Wayne State's going through a curriculum change at the moment, which I think is great, and it'd be great if we can use this to sort of sidle in the street medicine training, homeless folk training. And
Mm-hmm.
there's, you know, pockets of it that happen through our education, but I don't think it's this coordinated thing.
Yeah.
And the reality is we live in a city, Detroit, which has
Exactly.
a large population of homeless folk.
Exactly.
And what, you know, I think if we want our education to really be comprehensive, we want it to be appropriate to where we're living,
Mm-hmm.
I think it just makes so much sense that it becomes more part of the curriculum. Yeah.
I feel like Wayne does kind of want to train us to serve the community that we're in,
Yeah.
but they still need to work on integrating
Right.
the homelessness curriculum into the mainstream curriculum for sure.
100%.
And it's just so prevalent.
Yeah.
And so
Yeah.
like to ignore it and
Mhm.
to not address it directly
Yeah.
through the curriculum would be, I think, a mistake.
Yeah.
I think it's great that like so many people are really excited about street medicine though, and I feel like we're getting more and more volunteers every single month. Like I feel like every new class is always really excited about street medicine.
Yeah.
I feel like street medicine does play a good role in kind of like educating the student population. But yeah, it'd be great to like also have it in the curriculum for sure.
Kind of off of that is where do you kind of, what are your hopes for people outside of street medicine? Like, what kind of impact do you want to see street medicine have on people, not necessarily directly the homeless population, but like, what kind of role can it play in the community in like raising awareness and like educating people in the community as well about this issue?
So not on the medical side, not on the medical student side,
Right.
but on the rest of
On the
the rest of
community.
the city.
Exactly.
Yeah. I think street med provides a unique opportunity to sort of educate the population about homeless folk from a different avenue.
Mm-hmm.
And I think there's at the moment there's amazing people doing amazing work around Detroit.
Yeah, exactly. Yeah.
And they're doing amazing work with homeless folk around Detroit, and we sort of have the privilege of working with them.
Mm-hmm.
I feel like they are lower down on the radar, and the reality of medicine, and I think the responsibility of being doctors, is that people listen to us, right?
Mm-hmm.
And so I think one thing that we can do using our sort of unique position as medical students and professional students and professionals is raising awareness of this very it's very prevalent social and medical need that is around there. And yeah, I think the way that the world works, that sometimes has more weight, and so I think that's one of the things that StreamAid can do.
Mm-hmm.
It's like one thing that we wanted to ask you. You were really involved in the hepatitis A vaccine initiative
Yeah.
last year with CDC. So can you talk a little bit about what we're doing with the hepatitis A vaccines,
Right.
and how did CDC kind of reach out to street medicine?
Right. So August 2016,
Mm-hmm.
we had sort of first hepatitis A cases in Michigan and around Detroit. It slowly grew and grew and grew until by July, they knew there was a pretty bad outbreak. So in about August 2017, so a year and a bit ago, the CDC reached out through an epidemiologist with the Michigan Department of Health and Human Services, and they were really going throughout the city and saying, okay, there's this outbreak, and they'd been doing this previously, but they were reaching out to organizations saying, hey, can you be part of our vaccination campaign?
Mm-hmm.
And they were looking at folk who had were particularly at high risk of this outbreak, and they noticed with this outbreak, homeless folk was one of those populations.
Mm-hmm.
So they heard of Street Medicine Detroit, they approached us, we met with them, it took us about a month to get all of the training and make sure that we had all of the storage facilities and all of the transportation of the vaccines, because they have high standards, which is good. And then we started vaccinating homeless folk for hepatitis A. And this was right when it was actually the peak of the hepatitis A outbreak.
Mm-hmm.
And I think now there's just under 1,000 cases that have happened in Michigan since then. There have been a number of deaths. But I think whenever we went out into the street, we offered hepatitis A, and we still do, hepatitis A vaccines to our patients.
Yeah.
And so I think within a couple of months we had done about 200 vaccines, which when you think about it, it's like, well, that's not that much.
Mm-hmm.
But for a high-risk population, in Detroit, Detroit annual rate of homelessness between 11 and 16,000, right?
Mm-hmm.
So 200, it's small of the annual rate, but it's something. And so I think coordinated with other events and other campaigns around the city, we were able to vaccinate a decent number of people, and that was 200, I think, that was in the first couple of months. So I think that was up until about April, and since then we've continued our vaccination efforts.
Yeah.
Yeah.
Awesome. Yeah, I was really impressed with the whole hepatitis A vaccinations. Like when I first joined street medicine, and I thought it was really cool that CDC reached out to Street Medicine Detroit to kind of be involved.
We were like, man, are they sure? Is this right?
Yeah.
But it was great, and it was talking to them, and we were able to be transparent about what we do,
Yeah.
and they were, it was incredible because I went to a sort of follow-up CDC. They came to Detroit and they got all of the partners who were helping with Hep A vaccines and those dealing with homeless folk and a whole bunch of things. And there was a small meeting large small meetings. And they was okay, how can we brainstorm to get these vaccines out there? And someone was like, oh, we have this innovative idea. Why don't we take vaccines to like shelters? Why don't we take vaccines to where people are eating? And myself and Amanda, who's the other vice president, we were seeing and looking at each other, be like, this is what we do. Right? This is us. So it was just cool to have that validation that what we're doing is something which other people are, one, they recognize, and they recognize that it works.
Yeah, that's awesome. Who are some of the other people who are doing vaccinations, like other than students?
So one of the best people, remember Covenant Care, that
Right.
FQHC,
Yeah.
I think they some have the highest rates of vaccination. And they deal with a low income community as well. So FQHC, there's a lot of other clinics in the area that are doing it. We're the sort of only homeless outreach on the street that's doing it at the moment. Yeah, there's a number of places.
Yeah, I just think again it just goes to show how street medicine has situated itself in the community by going to the community,
Right.
and working with all these organizations, because without them they have no, like, we don't have like a foundation without all these partners. And so when all these people can get together and work on this problem,
Yeah.
of like, that's when you can start to see an impact, and that's when you start blunting this outbreak of hepatitis A,
Exactly.
which is just really exciting. I mean, it's incredible.
And I think like you said, like this is proof and concept of that. Okay, when we bring the community together, when we have this coordinated effort with all of the shelters and those that do outreach and those that are working in clinics, and we'll bring them together, then we can address what is a pretty bad outbreak. And now the outbreak is definitely, since January, I think numbers have been going down and down.
Mhm.
So
So
good success.
the way that street medicine is structured is
Yeah.
basically that next year you will take over as the president,
Yes.
and you will move into that role.
It's not very democratic.
Yes, I don't know how you got that gig, but
Didn't vote for you.
it was the accent. It was probably the accent. No,
Probably.
No.
Well, in fact, I'm from Zimbabwe.
Yeah.
With great dictators there.
no.
But I
All,
feel like it's great because like you grow up in the organization.
And I think that's all jokes aside, I think that's why it's there, and that's why it's been
Yeah.
there since the beginning.
Mhm.
2012, they realized if you want to make change in something, you have to be in the organization for a
Yeah.
while.
Mm-hmm.
Sorry, but you were going.
No, yeah, you're good. And so, as you move into that role, and as you've grown with the organization, you've seen its trajectory in the last couple of years. Where do you see its trajectory moving forward with your year of leadership and beyond?
Yeah. So honestly, one of the things that I would like to, there's a number of, I think, visionary ideas that I have for StreetMed.
Mm-hmm.
We started working closer with medical schools in the area and other programs in the area. We work with nurse practitioners, and I think sort of solidifying that relationship and trying to figure out, okay, how can we bring medical students from different institutions, and how can we all sort of learn together and serve our patients the best. So I think that's one aspect which I think we would like to develop, and I think that could be a great model to show medical schools around the country as well, like, hey, like we can have an impact, and we can have an impact not isolated but together.
Mm-hmm.
So I think that's one of the things. Second thing is, like I said, I'm big on education. So
Yeah.
One of the things that I'm hoping to do is try to figure out how can we incorporate more education ways into the curriculum and talk to administration about that, and also have more into the curriculum as well of residency programs as well. So we have a lot of residents that come out with us, and how can we make this something which they don't just do when they can, but it's sort of protected time for them,
Yeah.
so that it becomes something that I think individually they see this is important, but when their program recognizes that and says this is something important, that we're going to make sure that you do this once a month or once a week, or do a stint of this. I think that would be great.
Yeah, I feel like especially in Detroit, that would be amazing if we
Yeah.
get more residents out there.
Yeah.
That's amazing.
And there's a lot of residents in the area.
Mm-hmm.
Yeah.
And then sort of the fourth thing is expanding, I think, our reach. So I think we're decent in the downtown area, we're decent in the midtown area, somewhat in southwest Detroit. But there's so much. Detroit is large, and it's
Huge.
sprawling. And I think there's a lot of places which we just don't reach. We haven't been able to reach because of resources. Now that we're slowly growing, and we're finding more funding, and we're finding more personnel, I think that we can start going to other places. And the way that the city is changing, I think we're going to need to do that to make sure that we're reaching sort of folk that really need it.
Exactly.
Yeah.
And I guess that would have been a good last question, but one last question before we go is, do you know what specialty you want to go into?
I do not. I am playing around with several specialties at the moment. So my short list is primary care, and so I'm thinking internal medicine, pediatrics, or psychiatry.
Mm-hmm.
And then we'll
See from
go
there.
Yeah, exactly.
Yeah.
All right.
Who knows?
That's awesome.
Well,
Well, this has been great. Thank you
Yeah.
so much for coming to Perspectives and talking a little bit about street medicine.
Thanks for having me here. It's been great.
Yeah. Thank you so much, and good luck with your role in the future here.
Thank you. Thanks, guys.
You can catch us each month, the first Wednesday of every month. We will be on however you get your podcasts, or on our website, or on YouTube. And so, thanks for joining us, and we're excited to have you next month.